Clinical anatomy of breast. The breast is an accessory organ of the female reproductive system. Situation: the breast lies in the pectoral region. It is divided into 4 quadrants: the upper medial, upper lateral, lower medial, and the lower lateral. The axillary tail of Spence is a small extension of the upper lateral quadrant. This axillary tail of Spence passes through an opening called as the foramen of Lange. So this extension of the upper lateral quadrant is the axillary tail of Spence, and this opening is called as the foramen of Lange. Extent of the breast. Vertically, it extends from the 2nd to the 6th rib, and horizontally, it extends from the lateral border of the sternum to the mid-axillary line. The breast is separated from the pectoral fascia by loose areolar tissue called as the retromammary space. Structure of the breast. The parenchyma is called as the mammary gland. It consists of conical projection called as the nipple. The nipple is pierced by 15 to 20 lactiferous ducts. The skin surrounding the base of the nipple is pigmented and forms a circular area called as the areola. This region is rich in sebaceous glands. These enlarge during pregnancy and lactation to form raised tubercles of Montgomery. The mammary gland secretes milk. The gland consists of about 15 to 20 lobes. Each lobe is drained by a lactiferous duct. Near its termination, each duct has a dilation called lactiferous sinus. The suspensory ligaments of Cooper anchors the skin and gland to the pectoral fascia. So let's see the diagram. We have the nipple region, the lactiferous ducts, lactiferous sinus, the lobes, alveoli, and the retromammary space. Blood supply of breast is received by the internal thoracic artery, lateral thoracic artery, the superior thoracic artery, and the acromiothoracic artery, which are the branches of the axillary artery, and the posterior intercostal arteries. Nerve supply of breast. The breasts are innervated by the anterior and the lateral cutaneous branches of the 4th to the 6th intercostal nerves. Lymphatic drainage of breasts. The lymphatic drainage is divided into lymphatic nodes and lymphatic vessels. Under lymphatic nodes, we have the axillary lymph nodes and the anterior thoracic lymph nodes. Under lymphatic vessels, we have the superficial lymphatics and the deep lymphatics. 3 important things to remember under lymphatic drainage is that 75% of the lymph drains into the axillary nodes, 20% of the lymph drains into the anterior thoracic nodes, and 5% of the lymph drains into the posterior intercostal nodes. Development of breast. The breast develops from an ectodermal thickening called as the mammary ridge, milk line, or the line of Schultz. The persisting part of the mammary ridge is converted into a mammary pit. Clinical anatomy. Amastia is absence of breast, athelia, absence of nipple, polymastia, extra breast, polythelia, extra nipple, gynecomastia, development of breast in males which occurs in Klinefelter syndrome, The first lymph node draining the tumor bearing area in case of carcinoma is called as the sentinel node. Pure the orange appearance means edema of the skin, giving rise to orange appearance due to cancer cells. Retracted nipple is a sign of breast tumor. Mastectomy means surgical removal of breast.